Hi, everybody. Welcome to our Homage web series. So, today we'll be talking about some tips on post surgery and post operative care at home. So, today I'm very honored to speak to Sally, Norsalawati actually. She's our care specialist based in Johor for our Homage web series. And Sally has been a registered nurse for over 25 years, right, Sally?
Yes, right.
Yeah. So in both government and private, and her experiences include working in all fields, medical, surgical, critical care, and cardiothoracic care, right? So
Um,
it's so good to have you on board, Sally, for your
Thank you.
first Homage Web series. So yeah, so let's move on to the first question that we have. Um, what should I prepare at home before my loved ones or a senior comes back from the home after surgery?
Okay. First of all, thank you for inviting me. So, based on my experience, I believe that when come to the preparation, so it's not only after the operation, but also before the operation. But again, the point or the tips that I'm going to share with you today, it will be like overlapping here and there because actually, if we can do it before, then the post will be, very smoothly
Mm,
processed. For me, I use 5S.
okay,
Okay.
5S.
Now, the
Okay.
first S is safe space.
Safe space. Okay.
Safe space or safe environment. Okay, means that
Safe
the
space.
first S mean is if, for example, previously before operation, the elderly is staying in the room upstairs,
Okay.
please look for a convenient room downstairs.
Mm,
No need for the elderly to climb the stairs, is
yep.
it?
Yep.
So that is most important thing, and of course, and try to clear the pathway means that there's an adequate space in the room because we need to assist him to or the elderly to wake up from the bed, you see, and using walking slowly to encourage the ambulation. So we need a very uh, spacey
Mm,
environment. So
yeah.
try
Make
to
sure it's
clear
not
the
sempit
walking
lah.
pathway.
Okay.
Ah,
Okay.
yeah, sempit, you see. So, for example, like the pathway going to the bathroom, for
Yep.
example, try to clear and then try to make sure the floor is a trip hazard.
Yep.
Trip hazard means anything can cause the elderly to trip. So, for example, like carpet, that's not convenient for him. Try
I
to
see.
clean it away, put away, and also most important is the needful things. For example, you have a bed, and then beside the bed is all the needful things it's reachable for him or for the elderly. So we don't want them to move so much until there's a risk of fall there.
Mm,
Okay, this is the first S. The second S is suitable bed.
suitable bed. Okay.
Yes. Okay. So if we can afford, we can buy or prepare or even rent a hospital bed because
Okay.
hospital bed is adjustable at the head and also at the leg.
I see.
So we can pro up the head or we can bring down or we can pro up the leg.
Mm.
So it's very convenient.
How much do
So
you think is
yeah,
a
this
normal hospital bed like price range?
uh, usually certain my experience they go for the second hand. We can
Okay.
get below 1,800 actually because once there are few second hand that's still very good actually.
Nice.
But
Okay.
again, if you think that the caregiver or the primary caregiver think that this is not important, maybe we can go for the standard bed. But again, cannot be too high and cannot be too low. And please
Mm.
do not let them sleep on the mattress on the floor because it will difficult with the incision wound, with the operation wound. They want to wake up from the mattress on the floor. It will be very painful,
I
very
see.
difficult for
I
the
see.
elderly.
Okay.
Okay, that
That's
is
really
the
good.
second S. The third S is sanitize,
Okay.
means clean environment.
Right.
Okay, so due to aging factor, so this elderly, their immune system is declined due to age, you see. So they need a clean environment because we must remember they have a wound. So we need to try not to expose the wound to any, unclean environment. So
Yeah.
make the environment must be clean, and most important, if you need to sanitize first, please sanitize before the elderly come back home. That is our third one.
Okay.
And the fourth one is the safety walking device
I see.
or safety walking aids, because a certain operation, the elderly may need us not only for us to hold them, to assist them in their ambulation, during their walking, for example, but they, we want them to feel that, okay, they are confident to walk on their own slowly in progress. So they might need a walking aids, you see.
Yes. Okay.
So that is the safety walking devices that we can get, for example, like crutches, walking frame, the one that are suitable for them according to the operation.
I see. Okay.
Okay, and last but not least is the surgery diet, our fifth S.
Okay.
So there are 5 S. Last is surgery diet, means we know after operation there are certain they won't have very good appetite, no appetite to eat.
That's
So
right.
we must prepare in advance, to and think maybe we can Google and see what is the food that can stimulate their appetite, you see. So of course from in the hospital they will start with oral fluid first.
Okay.
In the hospital,
Oral fluid. Okay.
oral, usually clear oral fluid first, and after a few days, once they already they're able to pass gas, after the operation, they will start with the nourishing fluid, and slowly with a soft diet,
Okay.
like porridge. But again, I don't think most of the elderly like that soft diet, you see. So think of how to serve the diet that they like most, and most important is suitable with their type of surgery.
That's right.
That is the 5 S that I can, as that can I give as a tips lah.
Okay. So
As
the
stipulation.
first S is
First S is safe
environment,
space or
safe
safe
space.
environment. Safe
Okay.
environment, easy to remember. Second is suitable bed.
Suitable bed. Okay.
Okay.
Third
Three
one
is
is
sanitize,
sanitary.
clean
Okay.
environment,
I see.
clean.
Okay.
Sanitize the room. Make sure the room must be clean. Number 4 is safety walking device,
Okay.
if
Safety
required,
walking
according to
device.
their type of operation. And number 5 is surgery diet,
Surgery
that's suitable to enhance back their appetite, you see,
Okay,
for
so
the elderly.
to all the viewers out there, there are 5S, and Sally is also starting with an S, so it's very easy to remember. Okay, thank you, Sally. So,
Okay, welcome.
for the second question I have, like, what are the kind of tips that you think would be very helpful for loved ones at home who are caring for, seniors who just post-surgery, right, or post-operative care?
In our life, we cannot, predict what will happen, you see.
Yeah.
So again, one of the tips, because when we call surgery, of course, there must be an incision,
Okay.
or we call it an operation wound.
Operation.
There's no operation without any, whether it's small or big. The incision wound, or we call it the operation wound. So the wound management, number one for me, most important is how to manage the wound.
Yeah,
That is the most
that's
important
right.
thing.
That's right. Okay.
Again, every day we must check for the wound, any early signs of infection.
Okay.
That's the most important thing. So as a family members, so we need to have a knowledge, or if you need a help, you can call the professional caregivers, to manage the wound. The part that, the viewers that you think that you unable to observe, for example, you don't have the knowledge how to know that this is already infected. So
Yes.
you can engage professional caregivers, to come and to manage just for the wound.
Okay.
So it's very important, because we have to monitor the wound every day.
Every day.
So,
That means you must actually open and clean the wound every day.
Yes, most of the operation, the doctors will suggest to open the wound and check for the progress, and after that proceed with the dressing. And of course, it must be a sterile dressing procedure. It's a sterile procedure with a sterile dressing set. All everything, the gauze, the swab must be sterile. So only a professional caregiver or nurses only can perform that particular procedure
Okay, I see.
to understand the sterile film, because this is an aseptic procedure, aseptic technique.
What does it mean by aseptic?
Aseptic, A means aseptic, from A, septic. Septic means already there's a accumulation of the microorganism.
I see.
A means without.
I
So
see.
without, and anything from aseptic means A means without any microorganism. We need to maintain the wound area from any microorganism, either bacteria or virus or fungus or any parasite, for example, like that.
I see.
So, and when we checking the wound, make sure there's no abnormal oozing. Means that sometimes it's like excessive oozing. So, and then there's got smell. Sometimes like faulty smell, maybe, and then excessive bleeding, and maybe it's like swelling so much. So something is not right. And if you touch surrounding the area, you feel that the warmness will be there.
I see.
So that is one of the sign of infection.
I see. Okay.
So then when we do we take temperature, we can see that this elderly might have temperature, high temperature. So in medical term we call febrile. You see, means that fever. If no fever, a febrile, for example. So they might have a temperature there, but maybe not so high, but still there's a temperature. So that is an early sign of infection.
I see. Okay.
So this is everyone that undergone operation was scared about infection. So they are very scared about that. And please do not wet, because we're still in the topic of wound. Do not even wet the wound, the incision area. Yes, but usually the doctor will say, okay, for this, because it's just an appendix wound, for example, so it's small. So so they will say, okay, I will spray outside there. Then it's after 3 days or 5 days, you can bath, you can take a bath. But if big operation, a major operation, usually they say, okay, don't wet the operation site, maybe after 3 to 4 weeks. But we can wipe the face, make them more fresh, comfortable at home. So, but we don't ever wet the wound.
I see. Okay.
It's the first thing that we must remember. Don't ever wet but in case it's suddenly wet, so we have to really wipe it, because we have to take out and make sure we have to do the dressing, according to the aseptic technique is what I say, sterile, everything must be sterile, and cover back to prevent any microorganism to accumulate at the wound area. And the most important, I noticed that some of the elderly, because they like to put ointment, minyak there, put ointment. So then suddenly when we see the wound become blackish color, red color, so many thing color, and then they put some lotion. Don't ever put that.
Don't put like any sort of analgesic cream or like that is not prescribed by the doctor. Like
yes. The doctors won't ask won't prescribe a topical means application for analgesic on the wound itself. So until they come for the next one is when they come for we call it a TCA, or doctor's appointment, for the wound inspection. Usually the doctors will say, okay, after 7 days operation, you should come for the wound inspection. After the wound inspection, the doctor check the wound, the doctor feels satisfied, and the doctor said, okay, and now you can take your bath, you can wet your dressing or something like that. Or if the doctor already noticed there's a sign of infection, the doctor might have to open back, and take out all the, maybe a slough there, and then maybe have to suture back. So this is the thing that we try to avoid. Wound management is very, very important.
I see.
Very, very important.
Okay. Besides wound management, what are the other tips that you can recommend? Maybe in
Okay.
terms.
Second is we once we bring our loved one, we bring back home, we need to promote a good circulation and also to prevent the blood clot, especially for major operation. For example, like laparotomy, major operation that how we know it's major. Number one is the wound incision is big. Number two, it take a very long hours. So when it take a very long hours, the operation, so the blood clot formation will be there. This is one of the complications. So if the doctor already prescribed in the hospital to wear a compression stocking, sometimes people call it pressure stocking, some call compression stocking. Continue to wear this stocking at home.
I see.
And then try to elevate the leg.
Okay. How many times in a day would you recommend to elevate the leg or
Once the elderly is resting or during the night. But again, during the night, not need too long, because when they turn their body, it's automatically that it won't be elevated anymore.
I see.
And try, because of course after the operation, some of our elderly will have this, we call it a confusion post surgery.
Yeah.
They have this, is you see, because of the anesthesia, the side effect of the drugs to make them sleep. So we try to encourage them to ambulate, or we call it walking around. But again, we need to hold them. Either they are walking with walking aids, as what I told for the first question, or we need to hold them, be beside them, and make them walk, because we want to encourage a smooth blood circulation, especially towards the in and out, the blood circulation surrounding the wound area.
I see.
That's most important. And
Okay.
some, for walking, for me, walking is one of the good thing that as exercise. Number two, that some doctors, they will encourage us to, for the elderly, to buy we call it incentive spirometer.
Okay.
There's a three ball there. Then it's some tools, you see. So usually the elderly need to like suck them in. When they suck, the ball will go up.
Okay.
Then there's a reading for it. So maybe for today, how many the ball can come out. So from there, actually this incentive spirometer is to expand their lungs and loosen up the secretion, because
I see.
because any major operation, they are under general anesthesia. So that time their lungs are not functioning. The machine will take over. So there will be a lot of accumulation of secretion. So if we don't take out the secretion, it will become pneumonia.
Okay.
So become pneumonia means infection of the lungs. Okay, beside walking, beside wearing compression stocking, beside elevate their legs, beside do the incentive spirometer, we can encourage them to do coughing exercise.
Okay.
Because already once before after the spirometer, they do the exercise. Then after that, the ball will come out. So maybe we can do 10 times in every 2 hours. Then after that, they will feel like want to cough. The secretion, a very thick secretion will come out. So ask them to cough out. But again, for example, if the wound is at our abdomen side or on the chest, for example, so it will be very painful to cough out. So take a small pillow, a square pillow, then hold it on the chest or wherever the area of the wound, and then cough.
Okay. But what if like the wound is on the hip or near it can be anywhere, right? So
if the lower part, the lower limb, no need to. You just hold.
Just on the chest area lah. Okay, I see.
Yes, because it's okay, because we don't want, like, if it's the chest or the abdomen. Of course, when we cough, you are using the diaphragm, the chest muscle, and also the abdominal muscle. They will feel pain.
I see. Okay.
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 Okay. We move to the third one is pain management.
Pain management. Okay.
Yes. Pain
So how
management
do you
means
care
that
for them?
medication.
Or
Pardon?
medication. So medication in terms of what the doctor has prescribed.
Yes, correct. So means that without a good control of pain management, according to the doctor's prescription, of course, the elderly cannot do, we cannot do dressing on the wound because we just touch only they feel pain, and also they cannot do exercise.
I see.
So we need a very good pain management. That means if the doctor already prescribed analgesic or maybe any painkiller, sometimes they will give two types of painkiller. Please give it accordingly to the time and the dosage given because some of the elderly will say, oh, I don't feel pain, I don't want. But actually, uh, they have to take it because once they feel pain, when they want to wake up and do walk around, they feel pain, they feel, oh, I don't want to walk, I feel pain. So pain, if orally, the painkiller or any pain analgesic for any tablet for analgesic must given at least 3 to 4 hours in advance earlier before we want to do any dressing
Okay.
and also before we want to do any exercise.
Okay.
Because of course we want to cough, for example, but we don't have any painkiller. So that's why they will reluctant to cough. I don't want to cough. It's very painful for me. So actually, why they don't want to cough? They don't want to reluctant to do exercise because they feel pain.
Yeah.
That's why in hospital, they have their own pain management team. So the same doctor will prescribe the suitable analgesic or painkiller according to the age of this patient.
Okay.
Not everybody can take because of their age, you see. So according to their disease, if they have any heart disease but they undergone an operation, so there's certain painkiller that they cannot take, so there will be a special medication or painkiller for them.
I see. Okay.
Mm.
Okay.
Okay.
Great. Okay.
Okay. And maybe the last one is nutrition.
Nutrition. Okay.
Okay, so number one, there's no wound management. After that, of course, exercise, and
Exercise.
then pain management. Before we want to do exercise, before we want to do dressing, of course, we have to give the painkiller first. Then we can proceed with these two, and of course, to enhance the wound healing. So we need a good nutrition.
I see.
Uh, that,
Okay.
that's very very important. So sometimes try to avoid any caffeine
Caffeine.
drink,
Okay.
although I know of course they love to
Kopi
take
O is like
coffee.
it's like a thing already. So what would be a good
Okay,
substitute
and
compared to Kopi
also
O?
for elderly they like, pardon?
What would be a good substitute if that elderly take Kopi O like every day, right? So what would be a good substitute then?
Even tea also they have caffeine, but again it's not easy for us to recommend like some nutrition drink, like something like milk, that it's not easy, but I think with their understanding we tell them that this is not good for you during your recovery phase. I think they will follow if they know it much earlier before the operation. They will understand rather than after they come back only we say, okay, you cannot take this, you cannot take that, you see. So
That's
the
true.
preparation before also is very important. And if they don't have any appetite, let them eat like small portion of meal but frequent. You see, and if still no appetite, maybe you can, in between you can introduce a biscuit that they like, or fruits. Most of them, because after the operation they were having some sore throat, difficult to swallow. Then we can, something that they like any juice, or any fruits that soft fruits that they can swallow. So that is my tips for the post-operation care.
Okay, thank you so much. So, um, I think that was 5 points also, right? Or 4 points.
Yeah.
4 points, yeah, yeah.
4 points.
Yeah.
Actually, 5 point. Number one is weight management. After that is exercise
Exercise.
to
Okay.
promote blood circulation, and
Then
then
it's pain.
pain
Yeah.
management. To get these two, to get I mean to check the wound, to do the dressing, and to do for them to do exercise. The pain management very important. So when
Okay.
the pain management is, we put it under medication.
Okay. Okay.
Okay,
And
and
then
also
nutrition.
yes, nutrition for.
Okay. Great.
Mm-hmm.
So,
Okay.
what would you say to someone who is right now caring for a family member? What would you say to them?
I believe from my experience, from my observation, I can see that at the early part, before operation, we already mentally make them ready. Be with them, understand their needs. So I think once you bring them home, or when once you want to take care of them, it will be a very smooth journey. So for me, there's four things actually. Again, 4 things 4 points that I can share. Number one is mentally supportive. So we, as family members, or the one, or next of kin, or no, because this is our loved one. Of course, we want them to have a smooth journey
That's
for
true.
recovery. So, what's the meaning of we need to mentally supportive of them. Means that from the early beginning, means that as what I informed earlier, uh, I mean, meeting the doctor, make the appointment for the
To
surgery,
be there
you know,
with them for the rest of
the
most of the
rest.
stages, like every
Yes,
stage.
until in
Okay.
the hospital,
Okay.
until discharge, you
Mm.
need to be there to give them moral support.
Okay.
That's most important. And then uh, uh, try if encourage them to ask more questions if they don't understand. And usually the earlier part, if they don't understand, sometimes they are just looking at us, we understand, but they don't understand what the doctor's saying. Why don't we go back and we try to draw? Okay, the doctor will do like this. After the operation, you will become like this.
Okay.
Okay, you will come out with what you will. There will be a wound in the area. There will be a line here. We call it a central line on your neck. There are so many wires there, so don't be panic. So sometimes when they realize, they open their eyes, they say, "Hey, where am I? Am I in heaven or what?" You know, some the elderly will say like that. So we called it a talk. We give them a reassurance that once you open your eyes, that means your surgery is successful. That is very, very important. If not, they will become aggressive
Okay.
due to
So
the
so to prepare
effect.
them before the surgery even started lah, right? Okay.
Yes, very
Okay.
important. The mentally
Mental preparation.
supportive. We support they are mentally. So because if not, they are feel like, okay lah, I'm doing this because you want it, because my children want it, not
Okay.
because they who want it. You see.
Yes. What are the other points that you would probably want to share also?
Okay. Beside mentally, of course, physically,
Okay.
you need to support them physically. Means that beside just being with them to show that you are there, you need to, when you are talking to them, make it's an eye contact, hold their hand, show that you care for them, and means that once it's successful, the first thing they open their eyes, they want to see you next to them. You see, so be
Okay.
there, always be there for them. That is for me, I call it is a
High touch.
yes, it's mentally supportive, emotionally supportive, and always hold their hand, and then be there. Don't worry, I'm here for you. Don't worry, I will be here. And number three is, of course, physical. Physical means not only be there and just observe them, but assist them
Okay.
in their recovery process. Assist them, hold them, assist them in all the tips I given in their wound management, in the exercise, in their to make sure they are not in pain. And last but not least, for me, after all this, that there are certain part that as I think the viewer will feel that they are not very expertise or not very expertise in certain part. So why don't you all consider to to engage a professional caregiver or professional support in this, not the whole part, because again, we want you to be there emotionally, physically, and also, mentally to be there. But it's not every day that every time that you will be there beside your loved one. There are certain times that you need to fulfill your, you need to go to work, you need to you look into your business, or that's why you need to bring the professional caregivers
Mm.
in certain procedure or certain task that
It's
is
very
not
important
manageable by
to
you.
get respite lah. Yeah, especially when you're juggling so many things in life, then it's always
Yes, yes.
important to take time off and let someone help as well lah. Okay.
Yes, because
Okay.
there's certain things that we feel at the end, we feel like, oh, I feel burnt out already, you see, because you need to be, the whole thing, mentally, physically, all your energy, and then also you need to prepare the food, to make sure you need the environment must be clean. So, there's a certain part, that we can engage a professional caregiver.
Okay.
Mm-hmm.
Thank you, Sally, for sharing. I think it is very educational and very timely as well when we talk about post operative care, because there are a lot of families out there who, even through COVID 19 and the pandemic, are caring for their family members at home because they might not want to stay in the hospital for too long. So, yeah, so thank you, Sally, for your time. And just want to put out a disclaimer there that this health information is provided for general informational purposes. So it is not a substitute for professional health advice. So if you need medical attention or you need to seek out just advice, do go to the nearest institution or get assistance from your relevant doctor. So yeah,
Yes, right.
thank you, Sally, for your time.
Okay,
And
welcome.
it's been a great time just learning and gleaning from you. So see you and have a good night,
Okay,
everybody.
see you again. Bye bye.
Bye.